Hello everyone, welcome to the Health Education channel. And today we are going to talk about COVID. I know we've been talking about for COVID for last 1.5 years, and you might be getting bored and tired, and I completely understand. But it is very important that we are aware of what is going on with the variant and mutation in a virus. Because we have been hearing for quite some time alpha variant, beta variant, gamma variant, and now delta variant. And there is one other variant which is a California specific, which is Epsilon. So we'll be talking about all the different variants, why we should be worried, what we need to know, and how we can protect ourselves. So without any further ado, let's get started with the PowerPoint presentation that I have prepared just for you. So please like and subscribe this channel. I'll be putting a lot more videos on health education moving forward from this point. Thank you. All right, then let's get started with PowerPoint. And this PowerPoint includes all the data that we need to know for the different types of variants. Just like any human being or any animals, virus is also biological and they do evolve over time because they are cellular versus acellular and evolution do take place over time. It's a connection between spike protein and a receptor that has been mutating, and that's why we are seeing changes in how fast it can transmit and have a clinical implication. So many individuals are getting more infected with changes in a virus that is happening throughout the world. So how does it take place? Let me give you an example. So before I go there, so WHO decided that let's create Greek alphabet based variant information to help keep us track that how many different types of variant we have. Otherwise, it's B.1.427. So it's a mouthful. So that's why they are creating easier solution with the Greek alphabet. Now, I'll give you an example with the tomato plants because I also do the gardening, and gardening is very close to my heart. So when gardener has the two different varieties of tomatoes very close to each other, pollination do take place, and when pollination do happen, they will grow the fruit, and it would all the fruits would taste exactly same. But if you have two different variety of tomato plants close to each other, you cannot save those tomatoes for seed for the next year because you will most definitely not have the same tomatoes because the mother plant that is producing the fruit, it's the same, but the seed that inside the new tomato that is growing has been mutated. So it's going to give a new variety. So that's how a lot of gardeners, farmers, scientists, they do a lot of studies on different varieties of tomatoes. Most of the time it doesn't turn out as good, but many times they do find a very unique variety. And that's why we have a new variety gets introduced every year. And a lot of hybrid tomatoes are out there available because of that. So in short, it's a mutation that is happening. Same thing with the virus. As it infects more humans, it mutates because it studies the human cellular structure. It studies how it's infecting it. So mutation do take place because millions and millions of humans got infected with it. It was first detected in November 2019 in Wuhan, and after that spread in the rest of the world started happening. So in late 2020, they detected in UK, and when the Moderna and Pfizer they came out, the discussion was going on if they are effective, if those two vaccines are effective with the UK variant versus South African variant. So I wanted to just provide that information that UK variant has a 50% increased transmission compared to the original virus that we detected in November 2019. And then, of course, there was increased severity based on the hospitalization and fatality rate as well. But there was no impact on a monoclonal antibody therapy, which was the initial therapy that was available before the vaccine was available, and minimal impact on neutralization. So vaccine works perfectly fine with the alpha variant. Now, beta variant is a South African, and in South Africa, also 50% increase in the transmission, different spike protein receptor mutation, but there was a significant impact on a monoclonal antibody in this mutation. And there was a moderate reduction in a neutralization by the vaccination. So it still worked. For Moderna and Pfizer, it was effective, but not as effective as the original or the UK variant. Gamma variant. Now, this is also very interesting. They didn't have that many cases with this gamma variant because it was first detected in Japan and Brazil, and they actually found it in a flight, and they narrowed it down by only few individual, and they were able to control it because that was a significant impact on the monoclonal antibody and also reduced neutralization by vaccination. So this variant is no longer in the question, or at least I don't think it's in a question. Epsilon. So this one was first detected in California in the US in October 2020. And we didn't think much of that. There was only 20% increased transmissibility. So we didn't think it was as bad as UK variant or South African variant. But here is the scary fact. Between October 2020 and January 2021, the variant accounted for 35% of the infection in California. Just imagine how fast this virus spreads. 35% of all, and we had millions of people infected. So we had a 35% of them coming from that. So that's only between 4 months. So which is astonishing and kind of scary as well. There was a significant impact that monoclonal antibodies did not work on it, and there was a moderate reduction, but still Pfizer and Moderna, they work well. AstraZeneca was not as impactful, so that's why it's not available in the US, but Moderna and Pfizer, they worked well. Now, the main variant that is in question right now throughout the world, Delta variant. It was first detected in India in December 2020. It was an increased transmissibility even compared with the B.1.127, which is alpha variant. So now, take a pause here and let's think about it. Initially, there was a initial virus that was detected. It was in Wuhan. Compared to that, 50% transmissibility increase in alpha variant, which was a UK variant. And now even higher transmissibility than that is an alpha variant. So virus is mutating rather quicker. And this is based on the data that they have in early 2021. It's been over 6 months. I don't know, it might have mutated again. We don't have the data on that yet. So there was a potential minimal reduction on a monoclonal antibody and moderate reduction in post-vaccination. But so far, all the studies and all the data that we have found, what they said that 2 doses vaccination, Pfizer, Moderna, AstraZeneca, they provided great deal of protection, and they were very effective in preventing Delta infection. Any single dose vaccine or just 1 dose of any one of these vaccine were not as effective. So that's why I would highly recommend that we have vaccine available, Moderna and Pfizer. Both of them, they are excellent vaccine, 95% efficacy, great choice. And another scary picture that I will show you around the world, what is happening because of the Delta variant. Delta variant may seem that it's only localized to India, but not anymore. Thailand already had a strict regulation of wearing masks and other rules to prevent the spread of COVID-19. But only 2 days ago, in a Friday, Bangkok and surrounding areas, they found spike in infection. So they put a lot of restriction on a public transit and opening time for the market. So they wanted to make sure that they can control the Delta variant. They had a 2,500 death in Thailand. So they have been controlling it really well. But the scary part is 90% of them have come since April. So 2020 was a very scary year for US. They controlled it well, but the Delta variant and other variant they have made through Thailand, and now the spread of the infection is increasing. South Korea, they were widely praised initially for the response to pandemic, and they have extensive testing and contact tracing. They have one of the most high-tech contact tracing available. But the main issue right now is the shortage of vaccine. 70% of their population still waiting for their first shot, which is kind of scary. And we are so glad and we are so lucky and blessed to be in the US that we have abundant amount of vaccine available. But people don't appreciate and don't want to take it. That's actually quite scary. In Vietnam, also imposed tighter restriction on Friday, locking down the Ho Chi Minh City, sorry if I am mispronouncing it, the country's largest metropolis and the economic financial hub for 2 weeks. 9 million residents are permitted to leave home for only buy food and medicine. So it's a scary situation in Vietnam. Currently, only 4% of the population, just let this sink in, only 4% of the population has received at least 1 dose of vaccine. So they do not have 2 dose 4%. It's a single dose. And they are hoping that 70% of the individual can be given vaccine to by the end of the year. That's a tough goal to reach, but I hope they can do it. And in India, India initially in 2020, they were doing quite well in controlling it. And then the Delta variant started spreading, and there is a significant shortage of hospital supply, beds, oxygen, even a lot of essential needs stuff. They were running on a short list, and they were having difficulties, lots and lots of challenges. A lot of people died as well. The new cases and death are now decreasing, but the biggest fear factor that they have is only 5% of the country eligible to get vaccinated have been vaccinated. So only 5%. India's population is 1.3 billion. And that's a huge population to give vaccination to. So they're having quite a bit of challenge in meeting the needs with the people getting sick with the Delta variant and giving vaccination at the same time. In Australia, they just found 44 new cases with the Delta variant, and they have actually put a new approach in moving quickly, target measures, and some of the pandemic scenarios that they are playing with. And they also want to make sure they impose a restriction again on a social gathering, wearing mask indoor, because this needs to be controlled. US, because of the hot weather that we are having, we have bought few months, but once the travel begins, Delta variant, I don't know if it already made through US or not, but if that were to happen, it would be a scary scenario. The only way to protect ourselves is having a vaccination and prevent any further mutation. So more people are vaccinated, the better scenario it is. And if anyone is scared about vaccination and getting COVID because of it, let me assure you that this vaccine do not have any virus part. It was old technology that they used to use viral toxoid or part of the virus in order to create vaccination. This does not have anything like that. This one has only the mRNA sequence from virus for our body to memorize it and create antibodies for that. So I highly recommend vaccination, and we have Moderna and Pfizer, both very, very good vaccine. So please take your vaccination and protect yourself. Also maintain certain precautions, because just because government has allowed indoor gatherings and not wearing masks, I would say certain gathering, you should always gauge the risk and wear a mask if you think it's necessary. And there are a lot of people, big crowd, there is always a risk, and I want you all to be safe. And currently there are 5 states that are doing really good in vaccination, but they were nowhere near the mark that we feel gives us confidence that we are protected, which is 80%. Vermont has 66% of the population vaccinated, and the number 5 is Rhode Island with the 59.58%. We need to have a goal of 80% individual in US vaccinated to have a safer neighborhood, safer communities, and safer country. Thank you all for joining, and I hope you like this way of presenting it. I shared a lot of information. If you have any questions or if you have any specific information that you want about the vaccination, please let me know. I have collected all this data from multiple resources, New England Journal of Medicine, JAMA, Up to Date, and CDC and WHO. So I hope you like the presentation, and see you again soon. Please like and subscribe to this channel. Thank you. Take care. Bye-bye.